Awesome. It looks like we have everybody in. Again, I'm Ron Kitchens. I am the Chief Executive Officer of the Birmingham Business Alliance, and it's great to be here. Great to have you all here, and great to talk about this really important topic. And usually our events are high pitched and exciting, and we're cheering on things. But today is one of those things when we need to talk about the hard things. And so I have been blessed the last 6 or 8 weeks as we've really all begun to come to grips with this next round of COVID. Dr. Wilson has really let me gain some inside information, see the data in real time, hear from the experts as he's briefed business officials, briefed elected officials about what we're facing. And in the last week or so, it's become really clear from a lot of you on this call that you want information that's not filtered from the media sources, not brought in national politics. You want the experts who are literally in the field or in the hospitals dealing with this, and hear from them and understand what's going on. And in particular, the briefing from the doctors from Children's, I think it's really important because it's something that I don't know that a lot of us have certainly we don't have expertise in, but we don't have access to those experts. So we want to bring in the doctors, Dr. Wilson, Kimberlin, and Schmit, and they'll introduce themselves. They'll do a much better job and won't stumble like I will. But we want to bring them in. A lot of you sent Q&A into us and our questions into us, and we want to make sure we get to those. If you have others, please enter them into the chat box. And Lauren is looking at that. She'll get those to me, and we'll do our best to get those answered for you before we leave today, because I hope there's questions, but I hope at the end of the day you have better answers, or at least better information to make informed decisions about what we know is an ongoing issue that we've got to deal with as leaders, whether it's leaders of business, community, or government. So I want to again thank the leaders that we have who joined us today. And Dr. Wilson, I think I'm supposed to go to you first, but if I'm wrong, you tell me which doctor to go to, and I'll move in that direction.
That's right, Ron. Thank you. And thank you for having us. I'm going to attempt to share my screen, which I've never been very good at. But let's see how it goes. Can you all see that okay?
Yes, sir, we can.
All right. All right. So okay. So yeah, I'm Dr. Mark Wilson. I'm your county health officer. I'm going to quickly go through some data just to update you on where we are and sort of what we're looking at going forward. This is something we look at is our cases per day by collection date, as opposed to when the results come in. So that helps correct for any data dumps that you might see. But, back in June, we were down to about 13 cases a day. And some days now we're seeing in the 500s cases per day in Jefferson County. You see a lot of variation. Some of this has to do with weekends. Some days there's more samples done than others.
Dr. Wilson,
yeah.
slide you're currently seeing is your introduction slide. So I have your name.
No. Yeah, I'm sorry. Gosh. Well, I told you I wasn't any good at this. Let me see if I can start over. And do, okay. Is that better?
No, sir, we're at the same slide.
Okay, now can you see the next one?
There we go.
All right, sorry about that. I never get it right. I apologize. Yeah, so again, this is looking at collection date, and you see a lot of bumps in this, but the lower numbers tend to be the weekends. But you see that we've gone from very low numbers, like less than 20 a day, up to 500s. If you look at the 7-day rolling average, it gives you a better idea of the trends. And you can just sort of see how we're going. We're averaging for the last 7 days about 480 something cases a day. We ignore the last 2 or 3 of the bars on this graph just because we don't have all those results in. So it looks like it's starting to go down, but it's really not. By the next day or the day after, these last few numbers will be higher because we'll just have more results coming in. But this is quite a dramatic increase in just a month's time. It's the steepest curve we've seen in the pandemic. It's gone up much quicker than it did during that last surge, which was a huge surge. This is another way we look at it, just looking at different weeks. So starting at the bottom, you can see in mid to late July or mid-July, we had almost a doubling, 97% up, and then 60% up the week after that, 46% up. Then this past week, 14%. So you do see that maybe it's trying to level off here a little bit, but we're kind of thinking that we might have almost another steepening of the curve as school is opening back up and more people are moving around and interacting for school and school-related activities. And then, of course, we have Labor Day weekend and other things like that, sports. So we're thinking it's going to really pick up again. This is another thing we look at is the age distribution. And you'll see there are 2 bars here. We have, well, first of all, we have the different categories. On your left, 0 to 9 years old, then 10 to 19, and so forth, different decades of age. And you'll see the blue bar is the absolute number of cases. And this is over the last 2 weeks. We do 2 weeks worth on this just to have enough data to make sure it's meaningful, especially when during times when our numbers are lower. So you'll see actually that we have a fair amount of representation now in this younger 2 decades of life, 0 to 9 and 10 to 19. And I'll show you another, and well, I guess the other thing I'll remark on, and this is the good news, is that our elderly population, my age and older, is doing relatively well. And that's because the vaccination rates are quite high. And, folks that are like over 65 or 70, it's like 75, 80% vaccination rate. Now, if you look, this is the last 2 weeks. Now, here's a slide looking at the last 2 weeks, which you just saw is on the bottom here. If you look at the 2 weeks before that on the top, you see a different distribution. For the last, I would say, few months, most of our cases have been in this age group of 20s through 40s, some in the 50s, this middle hump. That's been consistent. And then our school age kids have been a little bit lower. And then this last 2 weeks, you can see a pretty dramatic shift. We're starting to see it really pick up among our school age children. And this is one thing we're very concerned about. And this is kind of going into school. This is really, just as school is starting or just before school started. And I'm going to take a moment here just to remind folks, a while back, I made a recommendation that our local schools, private and public, follow the Alabama Department of Health back to school guidance. I didn't order schools what to do. We're trying to let school boards decide, but in that guidance, it says require masks and social distancing to open schools safely. So the schools that have chosen to have mask optional are not following this guidance. And the whole system breaks down if they don't do that. And we might talk about that more later if we have time. This is a slide done by Dr. Suzanne Judd of UAB. Some of you have heard of her. She does some modeling. This is looking at our hospitalizations going forward, looking at the Delta variant as what happened in the UK and what happened in India, and a little bit of experience looking at South Alabama so far. And this middle peak is the last surge where we got up to about 4,400 case hospitalizations in Alabama back in January. This is what she's projecting we could potentially get to 7,000 in Alabama near the beginning of September. That's the high end. It may be lower than that, but we're pretty sure it's going to be higher than it was in the last surge. And I'll mention that's projection she did back on August 4th, so it needs to be updated. This just real quick, looking at her projections on potential absentee rates based on these different models. These would be people who are out sick, anywhere from 1% to 4% of our population, and at the peak. And then the percent of the population that would be out sick from school or work due to, that would be out either due to sickness or quarantine. And that ranges from 6% to 19% of our population. So in terms of those of you in business who have employees, this worst case scenario and what we're seeing in South Alabama, it could have a big impact, and on our schools as well. This is hot off the press. In fact, I didn't take draft off of it. We're now able to resume doing snapshots from the Ames data. This is data that hospitals report in every day on their capacity, bed capacity, and their COVID cases. So this is today's report from noon today. You can see in the red here where we are adult ICU, adult COVID beds. We have a tiny bit of capacity, but it's in the red zone. And then down here, we have our hospitalizations, currently 472 in the hospital. This is in Jefferson County. We have 16 pediatric. Again, this is just a snapshot, so it's one point in time today. And then we have those ventilated, those in the ICU, and then the deaths. This is going to be posted on the Jefferson County Department of Health website twice a week, Tuesdays and Fridays. We may do it more often, but it takes a lot of work to put this together. But Children's has agreed to let us share their data, which is these pediatrics case, because a lot of people were wanting to see that. Just real quick, our vaccination rate in Jefferson County for the total population, 1 or more doses, 49.3%, fully vaccinated, 37.9%. This is one of the highest in the state. We're neck and neck with Shelby County. Our other surrounding counties around Jefferson County are all down in the mid 30s for 1 or more doses, so much worse. This is just a look at the vaccination curve for Jefferson County. We have seen an increase in demand lately, and so we're trying really hard to meet that demand. Currently at the health department, we have 3 locations. We're vaccinating at all 3 of those 5 days a week, and they have plenty of capacity, so come on down. And that's all I have for now. Thanks.
That was awesome, and I appreciate that. And to go to your the data on hospitals, I just pulled up UAB's individualized data, and they have 181 in the hospital. 20 when you look at that, 160 of those were unvaccinated. Only 21 of the people in there had previously been vaccinated. So when we talk about the importance of vaccination, I think we're clearly seeing it. You know, that's as my grandfather would say, there's some people that see the writing on the wall and claim it's a forgery. And I think this kind of data shows us that vaccination really does matter. The next presenter we have is Dr. David Kimberlin. Dr. Kimberlin is with the Division of Pediatric Infectious Diseases at the University of Alabama, Birmingham, and Children's of Alabama. And so Dr. Kimberlin, I'll turn it over to you.
Ron, thank you very much. And thank you all for taking time out of your, I know what are busy days to be with us this afternoon. I am co-director of the Division of Pediatric Infectious Diseases. I'm going to leave it though to Dr. Schmit to really talk more about what's happening at the Children's Hospital location right now and what we're dealing with, what we're looking at, and what the impact of that is. I do want to kind of bridge, though, what Dr. Wilson was talking about and what Dr. Schmit likely will be giving much greater detail on. I'd like to bridge that by leaving a couple of thoughts with you. The data slides that we saw Mark show are sobering slides, and we need to see the data, no question about that. But I do think as well, we have to recognize that a year and a half into this, there is a human tendency to get kind of bogged down in the numbers and almost like, you know, the Vietnam body count kind of scenario where you're sitting there and you're just watching little minute changes and you're maybe potentially missing the bigger, not you in particular, but a person might be missing that bigger picture of where things stand. I was on a call with leadership from the ADPH yesterday, and of course, Mark's numbers are updated from that. But on that particular call yesterday afternoon, think about this. The entire state of Alabama had 2 open ICU beds. 2. That's for adult and pediatric combined. Now it's loosened up a little bit since then. I don't know if people died. I don't know if people moved out. I don't know the circumstances at all. But that is what we are teetering on the brink of. This is, I'm going to use this word deliberately, although it's going to draw a parallel to what's happening in Afghanistan. And obviously I don't mean to make that parallel, but we are nearing collapse of the healthcare system in Alabama. And I've gotten to the point of where I'm speaking in more and more colorful language these last couple of weeks, but I honestly think that we've got to. This is if this is what's likely in front of us, and it may not happen, God forbid, hopefully it won't happen, but if it does, everything changes. It's not just if you get COVID and need to go to the hospital, or your child gets COVID and needs to go to the hospital, or your father or mother does. It's a matter if you have a heart attack and you get taken to the emergency room, there's nobody there to help you. The staff are overwhelmed with everyone else there. I mean, it is that kind of chaos. If you are in a car wreck or your family's in a car wreck, there's nobody there to help you. That's what is at stake and immediately in front of us. And these numbers, you know, some folks might say, look, we got through, you know, last January and February okay. I'd point out that for, you know, several hundred people, it didn't turn out so well because they died. But even if you look at that and say, we can weather that because we did it before, this is different. Our numbers are different. Our trajectory is different. Our enemy is different. This Delta variant is hyper transmissible. The only virus that is more infectious, the only virus that's more infectious than the Delta variant is measles. And so what we faced last year, what we even faced last winter is not what we're facing now. It is orders of magnitude worse now. So that's terrible. Not much uplifting talk there. I will say this. Where we have things that are in better place now than a year ago, it relates to the vaccines. And we also have, you know, 12 or 18 months of additional information, additional experience with the kind of mitigation strategies, the things that we can do to lower the number of cases. And none of these things are like walking over to the spigot and turning off the water. I mean, that would love it if we could do that. That ain't going to happen. What we're going to be doing instead is layering these mitigation efforts and getting to a point where the overall flow of water out, the amount of virus that we have in our community, gradually is decreasing over time. Ultimately, vaccines are what turns off the spigot, but that even if we got everybody vaccinated right now, there would not be enough time over the next 6 weeks or so to get to full immunity that we would have the kind of impact that we need to have over these next 6 weeks. So we have the tools to do it. We have the knowledge to do it. I do think, though, we have to be mindful, this is my opinion, that we also are in a different place in the pandemic in terms of where the public is and where the political leadership is with respect to what we need to do, what we have to make modifications in and to be able to get through these next few weeks and really even next few months. And honestly, we are unlikely to have the government step in and say, there is going to be a mandate, you're going to do this. And even if we did it, there's a lot of fear that the public would just, flip the bird and say, we're not doing that. That ain't that we're done with that. We're not ready to do that any longer. So that's where y'all step in. If you noticed on Mark Wilson's first slide, it said serving Jefferson County since 1917. What happened in 1917? The influenza pandemic. The 1917 influenza pandemic that helped lead to the end of World War I. The reason that Jefferson County's health offices opened up in 1917 is because the predecessor to Alabama Power said, we cannot have this pandemic continue the way it's happening because it is not good for business. It is not good for our employees. Our employees need to be able to go see the doctor and have a doctor, back then it was all him, have him, the doctor, be able to treat the employee. We've got to have beds in the hospitals to be able to have our employees taken care of. We have to have people alive out there to buy our service, to buy our product, in this case, electricity. We have that kind of a culture here. We have that kind of a legacy here. And I would suggest, if I could be bold enough to do so, that this is y'all's moment. And that, Mark, Erinn, and I and others throughout the health community are happy to give advice, give recommendations. But in many cases, people are tired of hearing us. And it's in y'all's self-interest, and it's in our community's self-interest to have the business leadership step into that space now, because the government has run its race. The healthcare system is struggling just to kind of stay on its feet at best. And now we need to hand the baton to the next group that can kind of get us there. And I truly believe it's the business community. Ron, I'm going to stop there, turn it over to Erinn, and I hope to learn more from y'all when we get to the question and answer portion of this.
Dr. Kimberlin, thank you. And to reinforce, we had a company call last week outraged because they had an employee who had a heart attack on the job. They called the ambulance, and the ambulance told them it was a minimum of 2 hours before they could get there. I don't know if the person survived or not, but I know 2 hours without medical treatment in that case is devastating. And so that isn't just theoretical, we're seeing it in real time now. So we do know the crisis is here and the system is breaking down. On top of that, we've got underpaid or undercompensated healthcare workers who are exhausted, and there's no backup for them. So we've got a system that's stressed. So, but Dr. Schmit, I'll come to you, and hopefully you have good news. No, hopefully you have more. You can burden us with more knowledge that we can then use to encourage people to make good decisions and stem this tide.
Well, thank you so much for having me here today. Like everyone has already said, I'm Erinn Schmit. I'm a pediatric hospitalist, which means I'm a pediatrician that just takes care of kids who are sick enough to be admitted to the hospital. I'm also the associate program director of our Pediatric Hospital Medicine Fellowship. And my most important job is that I'm the mother of a 3-year-old and a 6-year-old who are both in school here in the Hoover area. So my goal today in talking to you guys is to kind of get across to you that kids are getting sick with COVID. It's not just a cold. We're seeing a sharp uptick in cases. And I was hoping by kind of giving some illustrations of the kinds of patients that we're seeing, it might kind of give more of a human face to the pandemic that we're facing with these children. I've been a frontline healthcare worker since the beginning. I've been, our pediatric hospital medicine service at Children's has taken care of COVID patients since the very beginning. And we were really lucky in the beginning that kids really weren't getting very sick with it. But unfortunately, with the Delta variant, with this wave that we're currently facing, that's no longer the case. Our numbers are sharply rising. In January, this past year, which was our prior peak, as you could see from the graphs that Dr. Wilson shared, our peak for inpatients with COVID was probably in the low teens. Last week, we hit 22 inpatients here at Children's. In any given 24-hour period in the past couple of weeks, probably 20 to 30% of our admissions are kids who have acute COVID. And these kids that we're admitting with COVID are previously healthy. Last week alone, I had 5 patients that I took care of with acute COVID, and I was just one of 5 PHM services. So just to give you an idea of kind of scale. 4 of those teenagers were overweight, but they didn't have any other health problems. And 17% of teenagers in our state are obese. So, that's not a stretch. 1 of the patients was a toddler who had no prior health problems. So to kind of put a face with this, one of my patients was a teenage female. She got admitted with COVID pneumonia. Her parents were sick at the same time, and her mom actually got admitted to the hospital the same day that she did. She came in, needed oxygen, needed support for some respiratory failure that she was having. And her dad, unfortunately, got sicker while he was here in the hospital with her and had to go to the emergency room. So that left just her sister to be in the hospital and be her sole caretaker along with the medical team. Another teenager that I took care of last week is previously healthy other than having Down syndrome. And her family actually had an appointment to get her the COVID vaccine the very next week, but she got sick before she could make that appointment. She came in with fever and cough and difficulty breathing. She got admitted to my team overnight, and she got sick so much quicker that she actually ended up in the ICU before I even made it in that morning to see her. She needed BiPAP, which is positive pressure ventilation, for several days. And then I took care of her for another week after that, slowly weaning her oxygen support. She got IV steroids, remdesivir. The parents still were planning to get her vaccinated. Her mom was really great about asking me exactly when she should go and get vaccinated after she got better. And after looking up the guidelines myself, I told her as soon as she's past her quarantine, she can go get it. I think it's worth noting that no teenagers that we've taken care of admitted to the hospital have been vaccinated, and they're all eligible to be. So that's very pertinent. But it's not just teenagers that we're taking care of. We're also seeing little babies, neonates, up to 60 days of life, who are getting admitted with fevers. Because of their age, they're getting spinal taps, they're getting bladder catheterizations, they're getting blood cultures, and some of them are found to have COVID. Some are needing oxygen. We're also seeing toddlers who are admitted with fever and muscle aches, and they are found to have dangerously high muscle enzyme levels, which can cause kidney damage. I have a good friend who's a neonatologist here in Birmingham, and she was telling me that their group has been caring for 3 babies that had to be delivered prematurely because their moms were so sick with COVID. Of those 3 babies, 2 moms have since died, and 1 is on a heart-lung bypass machine trying to keep her alive. It is not just acute COVID that we're worried about. We know that anytime we see a spike in these cases, that several weeks later, we see a spike in multisystem inflammatory syndrome in children, or MISC. This is a potentially life-threatening condition. It can cause generalized inflammation. It can cause organ dysfunction, organ damage. A lot of times these kids need ICU level support. And we've already started to see a resurgence of MISC this week. One patient I took care of with MISC came in with fever, belly pain, vomiting. He finally got admitted to the hospital because he kept passing out. There was concern that he had appendicitis based on his exam, but then he went into shock and he ended up in the ICU needing pressors or medicines to keep his blood pressure up. When they echoed his heart, he had diffuse cardiac dysfunction. He had coronary artery ballooning, which can be a risk factor for a heart attack. And in addition to the heart damage, he also had kidney damage with creatinine over 3 times the normal limit. He ended up admitted for almost 2 weeks. He went home on high-dose steroids and aspirin, and he has to follow up with cardiology, rheumatology, and nephrology clinics. He was also really deconditioned from his long hospital stay and not able to move around like he was prior and do his activities of daily living. So he also had to follow up with physical therapy. So although he came into the hospital as a normal kid, he did not leave as that same normal kid. The Delta variant is scary, and it's making kids sick enough to be hospitalized. And our hospital volume is a problem, as you've seen by the numbers we've been illustrating. We were already very full this summer due to an unseasonable surge in respiratory viruses, and now our COVID numbers have tripled in the past month. And then on top of this, schools opened last week, and some of our schools aren't masking. Myself and my pediatric hospital medicine colleagues and our pediatric emergency medicine colleagues, our PICU colleagues, we're all bracing ourselves. We feel like a tsunami is coming, and we're scared. Because if we run out of beds, there's nowhere for our kids to go. The community hospitals are full of adults, and I don't know what the next couple of months are going to bring. So, my ask for you guys is, what can you do to help us? If you're 12 or older, please get vaccinated. And if you are going to be indoors, please mask, please social distance, regardless of your vaccination status. That's the best means that we have right now to mitigate the tsunami that our hospitals are facing.
So thank you for that sobering information. And I gotta admit, 2 weeks ago or so, I heard you do a similar presentation, and I had, so I was prepared for what I was going to hear, but I gotta admit, it's pretty tough to hear how bad things are getting, and you feel for these families and these children. Probably, I don't know if this is a Dr. Schmit and Wilson joint question, but somebody, one of the questions that was asked was, let me make sure, how does the severity of cases between, we'll call it kids 0 to 19 versus other age groups? Are kids getting sicker as a group than 20 to 40-year-olds? Because I think we saw such an impact on older populations that their numbers are better now. But is that impact different on children than it is on others?
I would say, in talking to my colleagues who do both medicine and pediatrics, so they take care of adults hospitalized at UAB and kids hospitalized here along with me, our adult populations are still more severe. We're seeing more of them end up in the ICU and having really severe consequences. So it's still proportionally in severity, the adults are being more affected, but we're seeing that sharp uptick in the pediatric cases. So it's a little bit hard to predict what we're going to be seeing in the next couple of months.
Dr. Wilson, I see you unmuted. Do you have thoughts there?
I was mainly unmuting to say Erinn should answer that, but yeah, and I think you've already heard that the adults that are in the hospital are younger than they were in the early part of the pandemic. So we're seeing people in their 20s and 30s get seriously ill, and we have had a few deaths.
Thanks. I think that answers that, and I think that's kind of what the data showed us. But someone writes that I'm on the board of the Birmingham Boys Choir, and I'm particularly interested in protocols or guidance for indoor rehearsals and concerts. And so I don't know, Dr. Wilson, if that's something
Yeah, I think you need to be extremely careful. I mean, part of this is because we just have so much disease in the community right now. I mean, everywhere you turn, there's going to be virus, and it is an extremely contagious virus, as Dr. Kimberlin said. And then add to that, singing in a group is about the most dangerous thing you can do with COVID. So if it's going to be done at all, it should be done with masks on, even while singing, and spaced out, and probably spaced a little bit more. Certainly, I mean, if people are facing in the same direction, that helps a little bit. But if somebody's in front of somebody else, you probably are going to need a fair amount of space, at least 6 feet, because again, singing can spew virus a long, long way. And then audiences, similarly, they need to be spaced out. People in the same household need to be 6 feet apart. I mean, in different households need to be 6 feet apart. And we would recommend masking universally throughout the entire thing for every single person in the building. I don't know, David, if you have anything to add to that. And you're muted.
Everybody should be masked inside, whether vaccinated or not, at all times, period. And that would include for a concert. I think it's a bad idea. I think there is no way to do that safely if you're inside. If you're outside, maybe not as well, but at least it's a little bit better because there's more of a cross breeze, to be able to literally push the virus away before it hits the next person. But this isn't the right time for that. This isn't the right time to go to Alabama football games. This is not the right time to be trying to live the lives that we want to live. And my plea here to kind of put a big bow on what I was trying to say before is y'all step into this if y'all could speak with one voice to say exactly what Mark and I just said, and Erinn ended with, everyone needs to mask inside, whether vaccinated or not. Businesses need to have that big sign on the door saying masks required to come in here. To the extent you have flexibility, and I'm not a lawyer to be able to say what that flexibility is, to require vaccination for your employees, to get out there in the larger world and say, look, if we want to get back to where we want to be, you know, where we can actually have good business activity and so forth, we have got to have everybody get vaccinated, and we have got to mask. In other words, make it not just an individual business, but the aggregate business community saying, this is what we have to do. The government's not going to step into that role anymore. They're just not going to do it. They should, maybe, you know, you could argue that, I would argue that, but they're not going to. And without, this is an all hands on deck moment, and we've got to be able to do it in a way with a unified voice, because there will be naysayers in the community that say, don't tell me what to do. And they need to be met, in my judgment, with a statement that this is in fact what a society, our community, the larger number, not just the individual, but the larger number of people, this is what we've got to do.
Yeah, and I appreciate that, and I think, you know, there is certainly discussion of that, and what society will, as you would say, give a big F you and not do these things. You know, there's a question that just came in that said COVID patients are being sent home from emergency rooms unless their conditions are severe. What is medically recommended for folks if they're not sick enough to go into the hospital, but, you know, sick enough to have showed up there? How do people take care of themselves beyond quarantining, and how do families stay safe? As Erinn's example of sick child, 2 sick parents, and now Sydney got 1 sibling, and hopefully that sibling was old enough to drive to get food for the family. How do we take care of each other in these times?
I'll make some general comments, at least for adults. You know, there aren't very many proven treatments for sort of at-home treatment. A lot of things have been talked about: ivermectin, vitamins, zinc, you know, these different things that are out there, some antibiotics. None of those have been proven to be effective. There are some studies ongoing on a couple things. So really it's a matter of staying home and monitoring for the key symptoms as when you should go, and staying in touch with your medical provider. And I would say if you're pretty sick, making sure you have folks that are checking on you, at least by phone. So the things would be, you know, it's more a decision about when to go to the emergency department. You know, are you having trouble? You're so short of breath you can't walk across the room. You know, do you have a pulse oximeter where you can actually check your oxygen and see if it's getting too low? That's a good thing if you have one. Are you vomiting and diarrhea so much that you're getting dehydrated, you're no longer making urine, or you're getting real dizzy? So those are some of the things. I think I would say, though, that people that are high risk for hospitalization, that have a lot of underlying conditions, or elderly, the monoclonal antibody therapy can be dramatically helpful for preventing hospitalization. And that has to be somebody who's caught relatively early. So be sure to ask about that. I know the hospitals are ramping up to try to make that more accessible, because that is a way to keep people out of the hospital. And I'll let others comment beyond that.
Dr. Schmit, can you comment on what are the supplies the family should have at home if a child gets sick, and to make sure that they're coming into, if you end up seeing them, they're as healthy as they can be when they get there?
As in keeping kids from getting COVID, or kids who have COVID?
Yeah, I guess I'm really thinking, I think keeping kids from getting COVID, we've kind of talked about that, but if you think they've got it, how do we get them treat it. You know, my answer to everything is Gatorade and aspirin. And I'm sure that isn't necessarily the best treatment for a kid, but that's my answer for everything.
So Gatorade, fine. Hydration, pushing fluids is great. No aspirin. No aspirin in children. We only use it really if there's like coronary artery dilatation and things like Kawasaki disease or multisystem inflammatory syndrome in children. Otherwise, it can have a bad complication called dry syndrome. So we do not recommend aspirin in children. Don't do that. But, you know, if they're having fever and they're miserable with that fever, it can give them Tylenol or ibuprofen, making sure they're drinking plenty of fluids. This is the, you know, as pediatricians, we don't love to give juice or sugar sweetened beverages, but this is the one time that I say, whatever they'll drink, just keep them hydrated. If they're vomiting or having diarrhea, that's especially important. There's really no over-the-counter medicines that we would recommend, and especially like over-the-counter cough and cold medicines can be dangerous, especially in kids under 6. They can have some cardiorespiratory side effects, so we do not recommend using those. Sometimes a humidifier can help just to kind of break up if they're having a lot of nasal congestion or coughing. In little babies who aren't able to blow their nose, you can do saline drops and bulb suction or like a nasal oral aspirator, like a nose Frida. But really, it's a lot of supportive care. Now we are, and Dr. Kimberlin could comment more on this, but we are able to give the monoclonal antibody to kids over 12, I believe, who meet certain criteria to try to prevent hospitalization, which is kind of some of the, I think, same criteria that we're using in adults. And just as a personal aside, my mom is a liver transplant patient. She's fully vaccinated, but she got breakthrough COVID after being exposed to my children, actually, who got COVID from summer camp. But she was able to get the monoclonal antibody, and I'm so thankful that she did. It kept her out of the hospital. I have no doubts because she was at high risk for hospitalization.
And Ron, if I could just just add to it real briefly. You know, what you heard Erinn say were the very standard kind of things that you know sound familiar to all of us as parents. What you heard Mark say was also identifying or calling out certain treatments, quote unquote, that some people are doing. Things like ivermectin, which you use to deworm a dog, or azithromycin, which is an antibiotic that is way overprescribed. And if you do, there's a very old study now, but it's a study that showed if you get that particular antibiotic, azithromycin antibiotic, you're more likely to die in the neck of a cardiac event over the next 30 days if you're an adult, compared with if you didn't get it. So these things they're unproven, they do not work, and they're harmful, potentially harmful. So it scares me with the embrace that the community has for some of these not good treatments to use for COVID, because we could actually be doing harm.
And just one other quick thing, you know, taking vitamins is, you know, not really likely to do any harm, you know, so that's okay. It's just not been proven. One thing I'm seeing a lot, and I get a lot in my inbox, is people saying, well, I am really healthy. I take vitamins, I exercise, I do all these things, I have a strong immune system, therefore and fill in the blank. I don't have to be careful. I don't have to get vaccinated. This virus is like Russian roulette. You could fit that description, perfect health, and still die from this. You could also be the least healthy person in the world, get infected, and nothing happens to you. So, you know, just nobody can assume anything about this virus.
So, and I do appreciate that. We had I think Dr. Wilson, this probably is for you. Somebody wrote in, I'm going to paraphrase, that are there other places to find data? Because it's that whole, you know, I didn't like this data set, so I'm going to go search for another data set. Are there other data sets independent of what you've shown us that people can use as a second validation of the data?
So I guess one question is whether you're talking about data like numbers of cases, or are you talking about like medical advice or information about vaccines?
My perception from this question is that it's about how many people are sick and what that looks like.
Yeah, I mean, there are multiple sources. I mean, ultimately, they do come from the same source where, you know, we do testing and it gets reported to your local, your state health department and then to the CDC. Vaccination is the same thing. It gets reported into the imprint system, then on to the state and the CDC. So, and then the hospitals, the same thing. We have this emergency system for reporting in, the AIM system. So ultimately the source is the same. I don't know what to say to people that just choose not to believe the data. I think a lot of that's coming from conspiracy theories. There are some legitimate questions like how many people are sick from COVID versus with COVID, those kinds of things. And those are sometimes a challenge because of privacy issues, but we're trying our best to try to shed some light on that. That particular question from COVID or with COVID, I think anytime you see numbers of people that have COVID or die from COVID, maybe some of those are over counts because they had something else going on, but that's counteracted by what we know to be undercounts on the other end, people that might have been found dead at home and we don't know for sure what it was, and it was COVID. In terms of getting information about vaccines or treatments, I think that's another thing. I mean, maybe you don't trust the health department, maybe you don't trust these doctors at UAB who, you get tired of hearing people like Dr. Kimberlin talk all the time. I would suggest, or you don't trust the CDC or the FDA. I mean, there are people out there that don't, go to the Mayo Clinic, go to Vanderbilt, some of these others that we all think of, and just double check there. They have excellent information as well if you want to go somewhere else.
And I would just add, you didn't hear Mark say go to Facebook or go to Twitter. And the other thing I would say is if someone wants to really get hung up on the numbers, I don't think it's going to be highly effective. I guess they can, anybody can do anything, but they're looking generally, in my judgment, looking for a way to feel less bad about what's in front of us. So I would suggest the better thing to do is go park outside or kind of across the street from a busy emergency room, and look at the ambulances stacked up trying to get a slot in to be able to unload their person that they're transporting in. That, I think, will give you a better image of just how bad things are.
I think it's a great image to bring up, and I think people owe that to themselves. You want to see the truth, go stand outside and see the truth with your own eyes. A question came in, and Dr. Kimberlin, this might be for you. If I've had COVID in the last, or I guess they just said previously, and I've been vaccinated, am I clear, and no way I can get it? And so, do we know the impact that previous cases of COVID really have had on our immune systems on a long-term basis?
We're knowing more and more. The honest answer is that we only have a year and a half's worth of experience with this because it didn't exist more than a year and a half ago. But what we know right now is that the breadth of the immune response, the strength of the immune response, and the durability over time of the immune response following infection with the virus is less good than each of those things, the strength, breadth, and duration of immune response following the vaccine. So in the question, the person who'd been previously actually had the disease and has gotten, let's say, 2 doses of the mRNA vaccine or 1 dose of the J&J vaccine, they've pretty well done what they can, and that's good. I commend them for that. At least for right now. We may or may not have booster recommendations to come. We can talk more about that if you want, but it does not mean that you are risk-free. It means you've done everything you can from the immunologic standpoint, but this Delta variant is a different virus than what we were dealing with previously. And it is hyper transmissible, hyper infectious. And a person, that's why we hear of these breakthrough cases, a person still can get infected. They're a whole lot less likely to be hospitalized or certainly to die. So please get your vaccine, hopefully not having had COVID before, but get vaccinated. But we've still got to live our lives cautiously now. I wish that weren't the case. And in June, I was kind of thinking it wouldn't be, but it is now.
I appreciate it.
To kind of echo what Dr. Kimberlin said and something I saw in the chat, the vaccine right now may not prevent you from getting COVID, but it is extremely effective in reducing your risk of death and reducing your risk of hospitalization. So there's still a very important role for the vaccine.
No, and I think there's a number of things in our lives that, we do regularly everything from seatbelts to birth control that we know may not be perfect, but we do them because it gives us the absolute best chance of safety. And so I question the sanity of people who want 100% guarantee in a world that nothing has that. So, before we get away, and we're almost out of time, and I'm so grateful the three of you took time from your incredibly busy schedules to do this. I want to, really, tease out the question of, and I don't mean to be a doomsdayer, I don't need to do that. What's the world look like for 3 weeks from now, with schools opening up, kids maybe masking at schools, but I drove by a playground the other day and there were all kinds of sports teams there and none of those kids had masks on. What should we be prepared for in the community, whatever that gestation period is, 3 weeks from now, particularly from the children's side? And at what point, and maybe this is Dr. Wilson, at what point is government going to have to step in and respond to what clearly is a mounting health crisis? Unfair question, but take it as you want.
You want me to take that one, Ron? Or, it's a two-part question.
Whoever'd like to, Erinn's the one that my heart is breaking for, because she's the one who's, I bet there's not 5 of us on this call who have enough courage to go in every day and take care of sick kids. And so my heart's breaking for her and her colleagues. So, but maybe it's David that can give us some insight too, because I think we're seeing the first wave of, I think maybe Erinn called it a tsunami coming at us, and I guess I want to know what we're really facing. And
I think we're facing collapse. I really do. I think our healthcare system will cease to function. I hope I'm wrong, and it's not guaranteed that I'm right. But that is what I think is in front of us. We are worse off now than we've been at any point during this pandemic, and we're partying like it's 1999. This isn't going to end well. And then I'm going to, after Mark, or in advance of Mark speaking about the government, I again say, don't wait on the government. The business community needs to pull together and say, I think, Ron, you said before that the public may say, well, if they can't go in your business, they're not going to. If they can't get on a plane, they're not going to. If there is an inconvenience to them, and there needs to be, because we have, this is an absolute urgent, critical situation that's in front of us. We have got to start doing things different. And I think it's going to take groups that have not traditionally been in that space to come together and say, now we are in this space. We are the leaders in our communities, and this is what we have to do to get through this. The businesses in the past have done that. The Alabama Power did it 100 years ago, and I think it's y'all's time.
Yeah, I wouldn't disagree. And if you want to get 150,000 people guaranteed to be vaccinated, declare that to go to an Auburn or Alabama football game on any Saturday, you've got to be vaccinated. Folks will do it. Then
call for that. Make that a public plea to the SEC commissioner. Really step out, and because if we sit here and wait for others to do it and we talk among ourselves, it ain't going to happen. And my fear of this, of being overwhelmed by the tsunami and having the system fail, is, I think, going to be a foregone conclusion.
I do not disagree. Mark, will you give us parting words before we finish today?
Sure. I have drafted orders for a countywide face mask order. That's one of the main things I've been thinking about, but I'm just going to be real blunt with you. I don't have political support, either from the state or locally. And I've been talking to a lot of elected officials, and I'm afraid that just another order coming from me or from, Big Brother may backfire. And so right now, I'm, the same as David, I would really appreciate help from our business community. At least those properties and indoor spaces that you control, please put a sign on your door to require masking, social distancing as much as you can. If, I'm thinking of a theme, we who are in control of this space, this venue, we are helping our hospitals, so our hospitals can help you when you need them. I don't know if that will resonate with people, but I'm begging for your help because I need your help. People are not listening to me anymore, and a lot of people are not people are just simply going to ignore orders coming from me. I'm willing to do it. I'm willing to die on that sword, but I'm really more concerned about how we actually get the result we want, what works best. And so I would be happy to have follow-up conversations with you, Ron, or anybody else about how we do that. But that's my thinking currently.
Awesome. The sobering information we got today, I think, and again, my heart breaks for what we're seeing in the healthcare community, and I've been outside the hospital and seen those and made the calls to the ambulance company that said, what's the deal? And they said, we have everyone working and every truck rolling, and we cannot get to patients with shorter than a couple of hours. So it may not show up as a COVID death, but we've got deaths that are taking place in our community simply because the system, as Dr. Kimberlin would say, is collapsing. So, this recording of this will be available late afternoon today on all of our social channels. We've committed to circulate it to the business community and to call the community to come together and find some solutions. No one has the power to solve this, but we all have the power to slow it down and let the system catch up with itself. And so you have our commitment that we'll continue to look for those opportunities and continue to push forward. So Dr. Schmit, Kimberlin, and Wilson, thank you for your leadership. Thank you for your compassion. And thank you for the love you share every day with this community. God bless all of you for being here. Stay safe, mask up. Bye, everybody.